Hi, it's Darren Chang with Great Nation Insurance, and today I'll be discussing the initial and the annual wellness program that Medicare offers, what's covered and what isn't covered. It's coming up next. Stay tuned. Okay, before we begin, just remember that we're going over what original Medicare covers on its annual program. Now, if you have a Medicare Advantage plan, you might check your summary of benefits and make absolutely sure how your benefits work on that particular plan that you're enrolled in. Okay, the Medicare initial and annual wellness coverage. We're going to touch first on the first visit, which is in the first 12 months. It's called the Initial Preventative Physical Exam, also referred to as IPPE. And then after that, the next 12 months, you'll have the annual wellness visit, which is also referred to as AWV. And then lastly, we'll touch on the routine physical exam at the end. Okay, the Medicare Initial Preventative Physical Exam. Medicare Part B, which is medical insurance, covers a welcome to Medicare preventative visit once within the first 12 months of you having Part B. You pay nothing for the welcome to Medicare preventative visit if your doctor or other qualified healthcare provider accepts assignment. The Part B deductible doesn't apply. However, you may pay coinsurance and the Part B deductible may apply if your doctor or other healthcare provider performs additional tests or services during the same visit, and the preventative benefits don't cover these additional tests or services. Okay, so what you need to know about this initial preventative physical exam, this welcome to Medicare first visit that you do in the first 12 months, is that anything you ask the doctor to do outside of what's covered in this visit is going to be additional. So if you're going in there and you're asking the doctor, hey, doc, I've got a cough, can you check that? Or I'm not feeling well, can you do this and do that? Well, anything that you ask for outside of what's covered in this visit is going to be additional, and that's what they'll bill you for. Now, on the next slide, you'll see what is covered in this first initial visit. Okay, so let's talk a little bit about what this visit in the first 12 months of you getting your Part B cover. This visit includes a review of your medical and social history related to your health, education, and counseling about preventative services, including these. And below here are all of the things in this visit. Certain screenings, flu and pneumococcal shots, and referrals to other care if needed, height, weight, and blood pressure measurements, a calculation of your body mass index, a simple vision test, a review of your potential risk for depression and your level of safety, an offer to talk with you about creating advanced directives, a written plan letting you know which screenings, shots, and other preventative services you need. Okay, next is the Medicare annual wellness visit. If you've had Medicare Part B longer than 12 months, you can get a yearly wellness visit once every 12 months to develop or update a personalized prevention plan to help prevent disease and disability based on your current health and risk factors. Your provider may also perform a cognitive impairment assessment. You pay nothing for this visit if your doctor or other qualified healthcare provider accepts assignment. The Part B deductible does not apply. However, you may pay coinsurance, and the Part B deductible may apply if your doctor or other healthcare provider performs additional tests or services during the same visit. And remember, these additional tests or services aren't covered under the preventative benefits. Okay, so what's important to know about the annual wellness visit is that it's basically an update of information obtained in the first initial visit that you did in the first 12 months. Now remember, anything you do outside of what's covered in this visit will be billed additional. It won't be covered under Medicare. It will be additional. So if you go back in and you say, hey, doctor, I'm not feeling well, can you check this? And it's not covered under that visit, then remember, you'll be billed additional for it. Now, on the next slide, if you're wondering what is covered in this annual wellness visit, it's coming up next. Okay, so let's go over what the annual wellness visit consists of. The cognitive impairment assessment is performed to look at signs of Alzheimer's disease or dementia and check for depression and other mood disorders. Your provider may order other tests if necessary, depending on your general health and medical history. The personalized prevention plan is designed to help prevent disease and disability based on your current health and risk factors. Your provider will ask you to fill out a questionnaire called a health risk assessment as part of the visit. Answering these can help you and your provider develop a personalized prevention plan to help you stay healthy and get the most out of your visit. It can also include a review of your medical and family history, developing or updating a list of current providers and prescriptions, height, weight, blood pressure, and other routine measurements, detection of any cognitive impairment, personalized health advice, a list of risk factors and treatment options for you, and a screening schedule like a checklist for appropriate preventative services. Okay, here is a list of preventative screenings for men covered under Medicare. We're going to start off with the abdominal aortic aneurysm screenings. That's once in a lifetime. Colonoscopy screenings every 120 months, or if you're at high risk, every 24 months. Cardiovascular disease screenings every 5 years. Diabetes screenings, if you're eligible, up to 2 screenings a year. Lung cancer screenings with LDCT once per year if you meet conditions. Prostate cancer screenings every 12 months and you pay 20% of the rectal exam. Bone mass measurements, osteoporosis every 24 months or more often if necessary. Depression screenings once per year. Flu shots once per flu season. And unfortunately, shingle shots are not covered. Now we're going to go ahead and move to the women's preventative screenings that are covered under Medicare. Mammogram screenings covered every 12 months. Cervical and vaginal cancer screenings every 24 months or 12 months if you're at high risk. Cardiovascular disease screenings every 5 years. Colonoscopy screenings every 120 months or if you're at high risk again, every 24 months. Diabetes screenings if you're eligible up to 2 screenings a year. Lung cancer screenings with LDCT once per year if you meet conditions. Bone mass measurements, osteoporosis every 24 months or more often if necessary. Depression screenings once per year. Flu shots once per flu season. And again, shingle shots not covered under Medicare. Okay, we'll end with the routine physical exam. Any exam performed without relationship to treatment or a diagnosis for a specific illness, symptom, complaint, or injury is not covered by Medicare. It's prohibited by statute. However, the IPPE, which is your first visit within the first 12 months, and the AWV, which is the next visit within your next 12 months, or other Medicare benefits cover some elements of a routine physical. Now remember, when you go in and you set up your routine physical exam with your doctor, you're going to pay 100% of the cost for that exam. Medicare will not cover it. Now, let's say, incidentally, you came in that day of the exam and you were ill or you had a symptom, complaint, or injury. All of a sudden, the doctor will make it diagnostic as opposed to a routine physical exam. And then guess what? It is covered under that visit. So just keep that in mind. Otherwise, it will be the patient's responsibility to pay 100% out of pocket for the routine physical exam. Okay, so one thing to keep in mind is if you have a Medicare Supplement Plan F and you go outside of what's covered in the initial and the annual wellness program of Medicare, then you won't have to worry about any out-of-pocket expense because remember, your Plan F will take care of both deductibles for Part A and Part B, and it'll also take care of the remaining 20% after Medicare pays its 80%. Now, if you have a Plan G Medicare supplement, you're responsible for the $203 one-time deductible paid a year, and then after that, Medicare will pay its 80%. The supplement will come back in and pay the remaining 20%. And remember, that Part B deductible resets every January. I hope this video has helped you, and thank you so much for watching. If you have any questions, feel free to reach out to me. You can call me at 918-398-0104, or you can text me at that same number, or you can email me at darren@greatnationinsurance.com. Be sure to check out our website at greatnationinsurance.com.